Welcome to The Explainer. If you're looking to understand the mechanics of overcoming substance use disorder, well, you are in exactly the right place. The path of addiction recovery can sometimes feel like this mysterious, overwhelming void, especially to those looking in from the outside, or even to those standing right there at the starting line. But today, we're going to demystify it. We're going to break down the clinical realities, the timelines, and the incredibly effective psychological tools that make this journey a structured, manageable, and honestly, deeply hopeful process. Let's get started.
Okay, let's dive into this, because this is where our understanding really needs to begin. According to the experts at the Gateway Foundation, the literal dictionary definition of sobriety is simply not being intoxicated. But, as you might guess, true comprehensive sobriety is so much more than just an empty space where substances used to be. True sobriety means gaining clear thinking. It actually allows your brain to reverse cognitive effects so you can make decisions and see life realistically. And also means freedom. Addiction entirely consumes your time, right? Obtaining it, consuming it, hiding it, recovering from it. True sobriety is really about getting that freedom back.
To guide us today, here is our roadmap. We'll cover understanding dependence and withdrawal, navigating the first 72 hours, coping with everyday cravings, mastering the urge surf, the 24-hour rule, and finding treatment and support. It's a safe, logical guide from the clinical reality to highly actionable strategies.
Let's move right into Section 1, Understanding Dependence and Withdrawal.
To truly grasp recovery, we have to establish a baseline of medical credibility.
According to the official clinical framework from the ICD-10, dependence isn't just one single thing. It's a whole cluster of behavioral, cognitive, and physiological phenomena. It's a complete systemic shift in the human body. Withdrawal, on the other hand, is defined as a time-limited group of symptoms that trigger when substance use actually stops. Now, what's absolutely crucial here comes from the Queensland Health Clinical Practice Guidelines. When managing this withdrawal state, patient safety is the absolute primary goal. It's not about forcing immediate long-term abstinence on day one. It is entirely about keeping the patient medically safe as their system recalibrates.
And that physical recalibration hits its absolute peak early on. This brings us to Section 2, Navigating the First 72 Hours. You don't just get sober all at once. And this brilliantly illustrates the distinct chronological phases of the journey. For the first 72 hours, the entire focus is just managing acute physical withdrawal, literally just getting through it safely. By the 1-week mark, the focus shifts to building new, healthy daily routines. And by the 1-month mark, the individual is usually navigating what we call post-acute symptoms, the lingering psychological and minor physical adjustments. It's a phased approach, and honestly, just understanding this timeline removes a ton of the fear of the unknown.
For that crucial first 72-hour window, the safest route by far is a medically supervised withdrawal. Looking at the clinical requirements, this involves 24-hour nursing care to monitor vitals. It involves nutritional support, mainly because addiction often causes severe nutritional deficiencies. And most importantly, it involves targeted medications. Medical professionals might use benzodiazepines or neuroleptics. Why? Well, because the sudden cessation of severe substance use can trigger life-threatening seizures and extreme agitation. These medications inhibit that dangerous central nervous system activity, allowing the body to detox safely.
Once that physical danger passes, the battleground shifts. Welcome to Section 3, Coping with Everyday Cravings.
Now, this next method is as simple as it is wildly effective. The HALT method. Often in early recovery, your brain misinterprets basic human needs as a craving for drugs or alcohol. So the next time a craving hits, stop and ask yourself, am I hungry? Am I angry? Am I lonely? Am I tired? If the answer is yes, simply addressing that basic unmet physical or emotional need can completely neutralize the craving. It's a fantastic mnemonic anchor to keep you grounded during those daily mental battles.
Building on that, Harvard Health recommends very specific action steps to protect your daily environment. Step 1 is to set a meaningful quit date. Step 2, ruthlessly change your environment. This means the complete, total removal of any reminders of addiction from your home and workplace. If you're quitting drinking, get rid of all the alcohol, for sure, but also throw out the wine glasses, the bottle openers, the corkscrews, the whole shebang. You have to actively engineer your surroundings to support your new habits, rather than accidentally trigger your old ones.
But look, even with the perfectly engineered environment, strong urges are still going to pop up. That brings us to Section 4, Mastering the Urge Surf.
This is the central metaphor of our explainer today. Recovery isn't about stopping the ocean of cravings, it's about learning to ride the waves. So the crucial point is the stark contrast between two mindsets. Traditionally, people try resisting an urge. That means suppressing it, trying to distract yourself, or judging yourself for even having the craving in the first place. Now let me tell you, it is utterly exhausting. Surfing an urge, which is a mindfulness technique, flips this entirely. It's about noticing the urge, accepting that it exists without judgment, and simply riding it out. You don't fight the water, you let it carry you until it naturally breaks and dissipates.
Psychologist Alan Marla developed this technique into 4 distinct phases. First, acknowledge. Notice the physical sensations, like maybe your mouth is watering or you're feeling irritable. Second, accept. Don't fight it. Just accept that the urge is there. Third, stay present. Use your breathing as a grounding tool. Picture yourself on the crest of a wave, breathing through that intense pulse of the water beneath you. Finally, reorient. Once the wave breaks and you feel more in control, gently bring your focus back to your surroundings. You've safely reached the shore.
I want to pause on this number for a second, because it might be the most encouraging thing you hear today. 30. When handled mindfully with the urge surfing technique, most cravings peak and completely pass within a maximum of 30 minutes. I know an urge feels like it's going to last forever, but it's actually just a 30-minute wave. If you can surf for half an hour, you win.
Which transitions us beautifully into another powerful psychological anchor. We've talked about surviving 30 minutes, let's move to Section 5, the 24-hour rule. Think about the classic mantra, one day at a time. The 24-hour rule is designed to completely reduce the overwhelming prospect of lifelong abstinence. It reminds individuals to commit to remaining sober for just the next day. You do not need to worry about next week, next year, or the rest of your life. Thinking about forever is terrifying, and honestly, it's a recipe for relapse. You just need to break your journey down into a manageable 24-hour increment. Just win today.
Let's move to and see how this builds massive long-term success. By only focusing on 24 hours, you promote intense mindfulness about your current triggers. It drastically reduces that heavy sense of overwhelm, and most importantly, it builds incredible confidence. Every single morning you wake up sober, you have a tangible achievement right there under your belt. Stringing those successful 24-hour blocks together transforms a fragile effort into an unbreakable chain, ultimately preventing relapse. Building that chain is a whole lot easier when you aren't doing it alone. This brings us to our final section, finding treatment and support. Because long-term maintenance requires community. A robust support network is literally the bedrock of sustained recovery. There are incredibly powerful, entirely free community resources available, like 12-step programs. Think Alcoholics Anonymous or Narcotics Anonymous. These provide peer support from people who truly understand the exact waves you are surfing. Alongside these, building healthy daily routines, like engaging in yoga, making time for music, or getting regular exercise, creates a holistic, supportive lifestyle that reinforces your hard-won sobriety. And hey, if you or a loved one needs to find professional resources right now, this is the gold standard. The Substance Abuse and Mental Health Services Administration, or SAMHSA, runs a national helpline at 1-800-662-HELP. It is 100% free, totally confidential, and available 24/7, 365 days a year in both English and Spanish. You can also hop online to findtreatment.gov to locate facilities near you. Get a screenshot, write it down, save this number. It is a direct lifeline to the help you deserve. So we've covered the medical safety nets, the timelines, the mental techniques of the HALT method and urge surfing, and the sheer power of the 24-hour rule. Recovery isn't an impossible mountain. It's a series of manageable waves, backed by structured support. So my final question to you is this. Armed with these tools and this understanding, are you ready to take it one day at a time? Thank you so much for learning with us on this explainer, and we will see you next time.